Vanakkam, good morning. In this video, we are going to discuss about the ovarian changes in menstrual cycle. This is an important long question from the reproductive physiology. The ovarian changes in menstrual cycle. The normal menstrual cycle is the 28 days. It is divided into the two phases. First 14 days is the follicular phase from the onset of the 5th day of the menstrual cycle to the till the date of the ovulation, 14th day. Ovulation normally occurs at the 14th day of the normal menstrual cycle. So 5th day to the ovulation is the follicular phase. From the 15th day to the 28th day is the luteal phase. During the menstrual cycle, the ovarian follicles enter into the different stages. In the follicular phase, first the ovarian follicles enter into the primordial follicle. The primordial follicle located in the cortex of the ovary. At the time of the puberty, 4 lakhs ovarian follicles present in the both the ovary at the time of puberty. The primordial follicles contains a ovum surrounded by the granulosa cells. The primordial follicles contains ovum. It is surrounded by the granulosa cells. The granulosa cells provide the nutrition to the ovum. It is also secrete the oocyte maturation inhibiting factor. The oocyte maturation inhibiting factor keep the ovum in immature stage till the puberty. The second stage during the follicular phase is the primary follicle. Primordial follicle is converted to the primary follicle. Here follicle sizes increases, ovum size also increases. The granulosa cell proliferation occur around the ovarian follicles. The connective tissue capsule form around the ovarian follicle. Starts here. The connective tissue capsule formation is start here in the primary follicular stage of during the follicular phase of the menstrual cycle. Vesicular follicle is the next stage of the follicular phase. From the primary follicle is next converted to the vesicular follicle. It is also called as the antral follicle. The follicular cavity is formed between the granulosa cells. That is called as the antral cavity. So it is also called as the antral follicle. Ovum is moved to the one side. It's surrounded by the granulosa cells, which forms the cumulus oophorus. This is called as a cumulus oophorus. Ovum is moved to the one side, surrounded by the granulosa cell, which forms the cumulus oophorus. Ovum is increased in size and diameter. It has a large nucleus and granular cytoplasm. The zona pellucida is formed around the ovum. So the zona pellucida is forms around the ovum during the vesicular follicle. The Perivitalian space is a cleft is present between the ovum and zona pellucida. In between the zona pellucida and ovum, the cleft space is present. That is called as the perivitalian space. Formation of the theca interna and theca externa is start here. Theca interna is secrete the estrogen. Theca externa is formed as the outer layer of the follicular capsule. Graphene follicle is the mature ovarian follicle. The follicular size increases up to the 10 millimeter. Follicular cavity is larger. Ovum reaches the full size. The zona pellucida is thick, very thick. The attachment of the ovum to the follicular wall is very weak during this stage, ready to release the ovum during the Graphene follicle. So, follicular size increases, follicular cavity is larger, ovum reaches the maximum size, zona pellucida is thick, follicular wall with the ovum attachment is very weak, ready to release the ovum during the Graphene follicular stage. The 14th day of the menstrual cycle, ovulation is occur. The ovulation is influenced by the luteinizing hormone. The 14th day is ovum is released from the ruptured Graphene follicle. Graphene follicles. Ovum is entered into the abdominal cavity and it is picked by the fallopian tube. It is entered into the fallopian tube. The fertilization mainly occurs in the fallopian tube. The ovum is viable for 48 hours. So, the fertilized ovum, if the fertilization is occur, the fertilized ovum is called as a zygote. So, fertilization mainly occur in the fallopian tube. Zygote reaches the uterus 3rd day of the ovulation. 3rd day of the ovulation. The implantation of the uterus, the fertilized ovum is implanted in the uterine wall is around the 6th day of the ovulation. The luteal phase of the menstrual cycle start from the 15th day of the normal menstrual cycle to the 20th day of the menstrual cycle. So after the release of the ovum, Graphene follicle is filled with the blood, that is called as the corpus hemorrhagicum. The blood is clotted, then it is converted to the corpus luteum by the luteinizing hormone. Corpus luteum is the glandular yellow body. So luteinization is occurred by the luteinizing hormone. The theca cells are converted to the theca lutein cells. Granulosa cells are converted to the granulosa lutein cells. The granulosa lutein cells produces the progesterone and theca lutein cells produces the estrogen. So the corpus luteum is act as the endocrine gland. The progesterone is important for the maintain the pregnancy. Corpus luteum is the glandular yellow body, luteinization done by the luteinizing hormone. So if the fertilization is not occur, corpus luteum is converted to the scar tissue, that is called as the corpus albicans. If the fertilization is occur, the corpus luteum is support for the pregnancy until the 3 months, until the placenta is take over the action for the support of the pregnancy. So if the fertilization not occurs, corpus luteum is converted to the corpus albicans. If the fertilization occur, corpus luteum support the pregnancy until the development of the placenta. Thank you for watching this video. If you like this video, press the like button, share your friends. Those who are not subscribed this channel, please subscribe. These videos briefly discuss the physiology topics. You must read the physiology textbook. Thank you once again.